Pregnancy can be joyful and exciting as you look forward to how a baby will change your life. But learning there is something wrong with your baby can change all of that. You might feel overwhelmed, wondering what will happen. You probably have many questions and need someone who can answer them. That's why we're here. The Colorado Fetal Care Center offers hope and answers 24 hours a day, 7 days a week. We're available immediately after diagnosis for as long as you need. Our team is devoted to helping moms in situations like yours. We've pioneered procedures, treatments, and therapies that have saved many lives. And we've built a space just for moms, so you and your baby can receive the most comprehensive care in the same place. It is important to know that not all fetal centers are the same, and the amount of information you find online can be overwhelming. We can help make it a little easier by suggesting you ask these questions as you look for the right center for you and your baby. What does a first appointment look like? When considering a center, you'll want one that is thoughtful about your time and how they schedule your appointments. Look for a center that tries to wrap all your appointments into one day, rather than having you come back to meet with each specialist. You'll also want a center that can offer you a wide range of tests and treatments. We know how important it is for you to meet your care team as soon as possible. From your first appointment with us, you will meet with your multidisciplinary care team, from maternal fetal medicine to cardiology to surgery, all on the same day, in the same place. With you as an important part of the care team, we'll review your tests, images, and diagnosis and come up with one plan that is best for you and your baby. Does the center perform fetal surgery? The condition affecting your child might require surgery before birth. Only a handful of fetal care centers in the country perform fetal surgery. When considering a center, you'll want one whose surgeons can perform open surgery in utero. You will also want to make sure their surgeon is on site, so you receive the care you need when you need it. Timing can be critical when it comes to fetal surgery. We're available for you and your baby 24 hours a day, 7 days a week. Our on-site fetal surgeons have performed hundreds of surgeries and interventions, meaning they're equipped to treat virtually any condition that might affect an unborn baby. Does the center treat the most complex conditions? When considering a center, you'll want one that can treat the most complex cases and will not need to send your child elsewhere if a situation becomes complicated. Our specialists have treated so many babies that rare conditions are common in our center. We specialize in complex conditions such as congenital heart disease, CDH, and spina bifida. We're one of only a few children's hospitals in the country with a labor and delivery unit. That way you can be close to your baby while you recover. A mom who delivers with us will be able to keep her baby's care all under one roof. Because the Colorado Fetal Care Center is located inside Children's Hospital Colorado, your newborn will immediately transition to our intensive care unit just down the hall from your delivery room. Once there, your baby will have a new care team of pediatric specialists attending to their every need. They are all experts in treating complex conditions affecting newborns. Does your medical team conduct research? A center with a robust research program can offer the most advanced and effective therapies and treatments. When considering a center, you'll want one with an active research and innovation program. It is one of our priorities to make groundbreaking discoveries and innovations so we can continue to offer the best solutions for complex conditions. Our research has led to the most cutting-edge treatments in the industry. We were the first to use 3D printing in prenatal spina bifida repairs, which has helped us achieve some of the best outcomes in the country. We hope you ask us about our ongoing studies and what that means for you and your family. When researching fetal care centers, you might come across numbers related to outcomes. Because there is no consistent approach for reporting outcomes, the way one place reports their numbers might look different from another. At the Colorado Fetal Care Center, we welcome the opportunity to help you gather the right data based on your situation. We'll gladly answer your questions and explain to you our outcomes and how we report them. For example, we have an 81% survival rate for all CDH cases. We have a 97.3% survival rate for cardiac surgery. And for twin-to-twin transfusion syndrome, we have an 88% survival rate for one or both twins. We encourage you to also evaluate outcomes in postnatal and long-term care, such as pediatric programs like heart and breathing. No matter where you seek care, we wish you, your baby, and your new family a bright future. To reach the Colorado Fetal Care Center, call 855-41-FETAL or visit us online